Okay, so hi everybody. I just wanted to introduce our session today, our virtual community town hall. So thank you for joining us. For those who haven't met me, I am the new member services manager at GlobalSkin, and I'm really excited to be working with an amazing organization and with patient leaders such as yourselves from around the world. Just to go over a bit of housekeeping for our webinar today. I'm going to let you guys know that we're going to be recording this session for all future members to browse in the members only area of our website. And in terms of duration for today's call, it'll be about 1 hour long with our presenter, Professor Chris Bundy, who'll be taking the first 15 minutes of the session to share her expertise. And then we'll have about 45 minutes for discussion and for you folks to really share your experiences with what's going on in the world today. So please feel free to use the chat pod feature at the bottom of your screen to enter any comments or questions throughout the presentation. We'll be muting everyone's video and microphones during the presentation, but afterwards for the discussion, we can, up to you, you can unmute yourself and share your video. So we're also really happy to see a lot of participants on today's call. And we'd love to capture a photo of everyone at the very end. So if you are comfortable, at the very end, I can unmute everyone's videos and microphones, and we can take a group photo at the very end. And if there's any questions throughout, please feel free to message me privately as well. So our CEO, Janis, will introduce our speaker today.
I actually thought I was introducing you, but that's fine.
Okay.
But I'm happy to introduce Chris. Okay. So it is my pleasure to introduce to those of you that have not met her, Dr. Chris Bundy. And Dr. Chris is actually one of the lead researchers on our GRID project, works in the area of measurement of psychosocial impact of dermatological diseases, and has been a phenomenal partner to work with over the past several years in the GRID project. So when we realized we were struggling with dealing with COVID-19, and we found that when we had conversations with Chris that it was incredibly helpful, we asked her to lead this session today. And so I think without further ado, I'm going to pass you on to the very capable Dr. Chris Bundy.
Thank you, Kristen. Could everybody hear me? Just put a thumb up if you can.
Yes, we can hear you.
Yeah, okay, that's great. Thank you, Christine. And this is a fabulous organization I'm really proud to be part of as well. Just a little bit more on my background that maybe might help you to understand where I'm coming from. I'm a health psychologist, so my remit particularly is to help patients to live well, living with a long-term condition, whatever that condition is. But I specialize particularly in inflammatory skin and joint disease. So I've worked in this field for 15 years or so now. And I also provide training for healthcare practitioners, healthcare professionals, to help support patients. So I'm treating you as though you were healthcare professionals who might need a little bit of extra support to be able to deliver that support to patients. So hopefully this recording will provide you with some structure, not destruction, some structure to be able to address in particular health anxiety, because I think that that's what you will be facing at the moment from the patients ringing in, and possibly yourselves, because we're all health anxious at the moment. So I'm going to go through the slides, and at the end of this presentation, we'll probably take about 15 minutes. We have a lot of time to talk. My time is open-ended, yours might not be, but I don't have to get off for any particular reason, so feel free to ask any questions at the end. So the first thing I wanted to say was, we're all aware of how challenging this coronavirus threat is at the moment. 3 elements have come together that will produce a stress reaction in anyone, in all of us. And that is, it's unpredictable. Apart from a very few experts, almost nobody predicted the impact of this event. It's unpleasant, There's very little doubt about that, whether you have minor symptoms and the fear that goes with just having the minor symptoms, or whether you have a more pronounced reaction. It's very unpleasant. And it's seemingly uncontrollable. And those are the three elements that produce a stress reaction. But it's the last one that I will keep coming back to throughout the presentation, because there are things that we can do to help people recognize that they have a degree of control over things and it's not completely uncontrollable. So I'll keep coming back to that. So when we're talking about information that you're giving out to patients when they're ringing in or when you're having conversations with them, the three key principles we need to bear in mind are keep information giving very short and very focused. So my advice that even at this stage would be to give as little information as possible, actually, because when people are anxious, they don't hear information. I will talk quite a bit about that. But there's a difference, and an important difference, between keeping things simple and oversimplifying and making things simplistic. Use adult language, so try not to play things down. Talk about things in technical terms if it's appropriate, but keep it short, keep the sentences short, keep the bits of information short, and check periodically that people have heard exactly what you wanted to convey. I'll keep coming back to that as well, because that's really important. Not overloading the conversation. And I'll show you a slide in a minute that illustrates this quite nicely. I've put up there, less is more. And that's really reinforcing the key point, which is try not to give all the information that you think is necessary in one go, but to give out the information, key bits of information come first and last in the conversation. What we remember first, what we remember most is what we hear first and what we hear last. So think about a conversation sandwich. If you have an opportunity to talk to people on more than one occasion, make a note of what you've covered first time and then build on it for second and subsequent times. And then the third principle is show that you're listening. And what I mean by that is not just assume that people are listening to you, because there may be a pause on the other end of a phone or a video conversation, but you have to reflect back to them that you've actually heard what they've said. And I'll show you a slide that illustrates that as well. So moving on to the next slide. This is something that we work with in terms of information processing on a very regular basis. It's called the demand error ratio. And really, it looks complicated, it's simple, but it's difficult to stick to. And that is, on the bottom, you'll see the number of points to be remembered in a conversation. And on the left-hand side of the screen, on that axis, you'll see the errors in recall. So those errors could be distorted information, misremembered or misheard information. But the key point is that as there are more things to be remembered, then the error rate increases as well. So this is just an illustration of less is more. Give less information, more of it will be retained. And there is that sort of magic number that we talk about, which is 7 plus or minus 2 chunks of information. And what that means is, if you're just having to remember the number of the bus or a route to get into the city, that's not necessarily weighted information. But health-related information is very much weighted. It has more meaning. And so we can process fewer chunks of information that's weighted than neutral bits of information. So pull back and remember that 7 plus or minus 2 and actually try and keep it to 5 chunks of information if it's really important. So I can answer questions about that later on if necessary. The third point, which is about showing you've listened. When we have conversations with people, we non-verbally acknowledge that we're listening. And we're nodding, and we might interject and stop the flow of information and say, oh yes, I know, oh yes, I understand. But there are different levels at which we can really indicate to people that we have listened. Simple repeating an element, rephrasing it, or saying, what the patient has said to you in different ways, in your ways. But the key point is that we listen between the lines of what people are saying, and we reflect what we think they're feeling. And then if we do that effectively, we really know, the person who's listening to us really knows that we have understood how they feel. So I'll go through my notes, but a couple of examples might be, a patient might be saying to you, how am I going to get my medicines? I've been phoning the pharmacy and I've not been getting an answer. I'm a vulnerable patient. I'm on treatment that makes me more vulnerable. The words clearly are saying that, they're not getting an answer at the pharmacist. They don't know what to do next. There's a lot of uncertainty. But the emotional content there is fear. They're frightened that if they don't get their medicines, they'll have a flare of their condition, or the condition will get worse, or that somehow they are more at risk, which of course is reflection of reality. But they need to know that you've understood how they feel. So just every now and again, you might want to say something like, I can tell you're really worried about this. You then might want to follow it up with saying, can I tell you what other people are finding really helpful? And then you can go on to give the information. So that bit about reflecting the emotion, asking permission to give information, means that the person on the receiving end is ready to hear what you've got to say. If you just wade in, ignore the fact that they're feeling so anxious, give them false reassurance maybe, or give them a piece of advice, they're not quite ready to hear that. So lower the barriers, reflect how they feel, ask permission, give them the information. And we find in general that works more effectively in terms of patients, people remembering what we want them to remember. So I put up this slide about recognizing worry and the worry-anxiety continuum. And I don't know what your background is, so many of you might be very familiar with this, but some of you may not. So apologies if I pitch it at the wrong level, but I'm assuming that many of you will use the words worry and anxiety interchangeably, but actually it's on a continuum. So my guess is that at the moment we're all worried, but we might not all be anxious. And of course, anxiety has its own continuum from mildly anxious to very anxious. So bear that in mind and check out with people. I'm guessing that you're really worried at the moment, or I'm guessing that you're really anxious about this. And the person will come back to you and say, well, I don't know if I'm anxious, I'm a bit worried. And so you get some feel for where they are on that continuum. But the way that you recognize where people are on the continuum in terms of what they're talking about is in three particular ways. Very often they have what we call biased or distorted thinking when they're very anxious. They selectively attend to the information that you're giving them. They might be listening to what's going on in the news and reading stuff in the newspaper that just confirms their level of anxiety, and that just fuels more anxiety. They might be unable to concentrate, or they find they have lapses in their usual concentration. So in a conversation with you, for example, they might go back over something they've already said. And often that's quite a sure sign of somebody's concentration is lapsing. They might have something called black and white thinking, and it's linked with this phrase catastrophizing. So, I mean, those are psychological terms, but essentially what they mean is that people jump to conclusions from how they think things are at the moment to how they're going to be in the future. And very often that's a huge leap from something that could happen to something in their mind that is going to happen. And so your job is to help them to recognize that there's a gray area in between that black and white thinking. And it might be useful to just every now and again say to them, I recognize that you're really concerned about that. Had you thought that? And maybe put the opposite point of view, or put a more neutral point of view to them, and just check out if they're able to see that there is a gray area in between. The second area that you will be having a lot of information about, and people will be telling you about, is symptoms. So the physical feelings of anxiety are very often confused with symptoms of their condition, or symptoms that they think might be indicating that they've got something else happening. Many people are just not tuned into how their bodies work, so they get confused with feelings of anxiety and feelings, symptoms of an underlying condition. So, for example, they might be talking a lot about systems upset, their stomach is upset, they're aware of their heart rate beating, their pulse is increased, they might be slightly shaky, or that they feel that they've got a lot of muscle tiredness and fatigue. Some of that, of course, may well come from their underlying condition, but also those are telltale signs of anxiety. We know that anxiety has a psychological and emotional energy cost associated with it. The very anxious people often report a lot of fatigue. So maybe just reminding people that their symptoms could be linked to their condition, but it could be partly accounted for by their level of worry. And then there are behavioral signs. And on this next slide, this gives you an indication of, and this is, the area that I'm concerned about in terms of behavior change, where people's usual way of going about their daily business becomes disorganized. They might have a lack of structure for their day. They get up later, they don't get out of their pajamas, they go to bed very late, they do a lot of comfort eating, possibly, reaching for the extra glass of wine, or if they smoking more. The behavior might become a bit impulsive, or what the hell, we're all going to die tomorrow, I might as well just have that extra bottle or glass of wine or whatever. They also might become quite inactive, so really lacking motivation, unable to get up in the mornings, not finding any reason to get up in the mornings, being very irritable. Their partners might, or family members might comment on the fact that they're more irritable than usual. And of course, their sleep pattern might well be disrupted. Some of these things are linked with underlying poor health, but some of them are behavioral signs of anxiety as well. So what can you do about it? You're on the other end of a phone or a laptop link or a video link of some sort. Encouraging people to create structure in their day will be really helpful for them. So encouraging them to get up at a breakfast time. Doesn't have to be super early, but it needs to be within a couple of hours window, around 8 o'clock, 9 o'clock possibly, but not straying too far from what the time that they would normally get up. Get dressed, and I would encourage patients, certainly the patients I'm talking to at the moment, to get dressed as though somebody might knock on the door, i.e. put some clothes on. Don't just stick your dressing gown on top of your pajamas, but get dressed as though somebody might come to the door. And that sort of creates its own momentum sometimes for people, and get moving. Be as physically active as it's possible for them to be, even if it's just sitting in a chair doing some chair-based exercises for 5 or 10 minutes, just keeping the joints going, keeping them moving, keeping their motivation building. And to have a daily goal. So today, for example, because I'm on lockdown as well, my daily goal was to make sure that I did my usual exercise first thing in the morning, but also to go out for a run at lunchtime, because I haven't been out for a run for a week. Now, that's me, and obviously I'm able to do that. And people have to find their own level. But for me, just achieving that daily goal gives me a sense of control over what's happening, and so I'm not just at the mercy of having to be contained in the house, that I can have a little bit of control over what happens. And so that's the second point, really, helping them to take control over some aspects of their lives. Encouraging people to stay in touch is really important. Staying in touch with their family, with their friends, with their healthcare practitioners, or with you or whoever it might be, but to do that in a measured way, so that they're not bombarding those people with 2, 3, 4, 5 phone calls a day, And anxious people very often do tend to have too much contact with people in their lives, and often repeat themselves, which of course, being on the receiving end of that is quite difficult. And you might have already experienced that. So encouraging people to stay in touch, but to build it into a daily routine. So for example, with my children who are scattered over the country, we have a weekly meeting via a house party, which we do on a Friday. We've always had a Friday supper contact, which is quite nice, and we've managed to keep that going. But I make sure that with my other 3 children that I'm having a one-to-one with them once a week. So one week I'll speak to one, the next week I'll speak to the other, because they've got lives as well, and they don't want to be just going over the same old how is it for you sort of thing, because not an awful lot is happening at the moment, let's be honest. So keeping it manageable, I guess. Using distraction techniques is helpful. When people start to think anxious thoughts, feel that anxiety building, it's important to interrupt it and to do something. It really doesn't matter what it is. It could be something simple like a crossword puzzle, a word search, something really simple. It could be reading a chapter of a book if it's possible, thumbing through a magazine, using any distraction techniques that work for people. Encouraging them to keep notes on, in particular, on what they think they've done well. So if they have a daily goal, did they meet that goal? And how did they manage it? What did they do well? That's really important. I'll come back to that because we'll be talking about looking for patterns in people's reactions, and keeping notes is a helpful way to do it. And then the final point is we know that if people express gratitude, it supports their well-being. So before they go to bed at night, before they go to sleep at night, just thinking about 3 things that they're grateful for. And just reminding themselves that they're grateful for the fact that they've got through another of these lockdown days, that nothing disastrous has happened, that they have managed to be in contact with somebody and they've got a new piece of information, for example. So something very simple. Okay, so when people will be looking for reassurance from you a lot at the moment, and it's tempting to wade in with giving them false reassurance by saying something like, don't worry, it'll be fine. Telling somebody not to worry when they're worried is the least helpful thing you can do. So a more helpful approach might be to recognize the uncertainty that we are all experiencing. So saying, yeah, it's really difficult, isn't it, not knowing which news outlet gives you the best information. So recognizing that uncertainty is important, but to help them to focus on what is certain. So reminding them that you are there as a patient organization, you have access to experts who will give you up-to-date information that is guaranteed to be accurate and will not be based on some gossip or some fear-mongering that might be doing the rounds. So don't give false reassurance. Recognize that we're all uncertain, that we're all finding a way through this, but to focus on the things that are certain. The second point is to outline what areas of people's lives they can control. So using terms like challenge rather than threat. And so, I mean, I've been talking about the coronavirus threat, but I have to check myself every now and again and remind myself that, yes, of course it's a threat, but that's not helpful language to talk about it as the challenge. So we are all experiencing this challenge of having to stay indoors in order to protect ourselves and to protect other people. And challenge is something that we can deal with, but threat conjures up something that will fuel anxiety. So just be aware of the language that we're all using. And this other point is to restate to people what we know their values to be, or to ask them to articulate, tell us what's really important to you. What's the most important thing to you? So I'm doing virtual clinics with patients who have psoriatic arthritis at the moment. And of course, they are very concerned. Most of them are on immunosuppressant therapy. They know they're in a vulnerable group. And I have to keep pulling them back from that brink of health anxiety and say to them, you know, what's really important to you? They'll say things like keeping in touch with my family. How have you been able to do that then this week or today? Just remind me what it is that you get out of seeing your family. Well, I know when I see them on the other end of the video that they're all safe. So that's really important to you, isn't it, that your family is safe? Just simple statements like that remind people of what their key values are. And that's important, and I'll come back to why that's particularly important when we talk about change. The third point is to be available to people. Physically, you are available, you're on the other end of a phone or a webcast or something like this, but also to be emotionally available to them, listen, and tell them that you've really understood what they're concerned about. So you will need to give advice at some point, and my 5 top tips for giving pieces of advice is to keep it factual. Keep it short, keep the sentences short, key bits of information, work from what you know to be factually accurate. When people are very anxious, they tend to distort things and they might mishear what you say. So the less complicated and ambiguous information you can give, the more likely they are to remember the key points about taking the medication or about things that they can do to stay well. Pause periodically when you're talking and check that they've understood what it is you wanted to say to them. So the kind of phrases that I would use was, I've talked for quite a long time now, and I just need to check that you've picked up the key points. So just remind me what you think the key points are that we've been talking about. Or at the end of a conversation, I might say, we've covered an awful lot today. What's been the thing that stood out to you as being more important? And you get a feel for how people have understood what you've said by doing that. Keeping up to date, which is pretty obvious, but from your perspective as a key information giver to patients, is that you need to have up-to-date information, and you'll know better than me how to access that information. And the last point is keep it personal. What I mean by that is when people are asking for information, let's say about a particular medicine, it's probably less helpful to say things like, well, everybody who's on methotrexate, blah, 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 or everybody who uses that biologic, ... and say, people like you, or when you use your medication, or when you do something. So then they will actually feel like you're actually talking to them. And forgive me if you know this and you do it already, but a lot of the time I hear healthcare practitioners, healthcare professionals, talking about groups of people rather than individuals. And I know, because patients tell me this, that they don't want to be identified as a member of a group. When they're having a one-to-one conversation, they want it to be about them because they know they're part of a group of patients with a particular illness or using a particular medication. They can do that for themselves. Okay, keeping people motivated at this point in time is difficult. I'm not pretending it isn't. So again, remind them what their values are. You know, people will say to me, and have been saying to me, I'm really worried that if I don't get my prescription renewed, that my arthritis is going to flare again. That means my joints will be too painful. I won't be able to go out and get groceries in. I won't be able to do this. I won't be able to do that. My response to that is to say, I can tell this is a really challenging time for you because you want to be as well as you possibly can be, and you're doing everything that you can to stay well because that's really important to you. So I've kind of listened between the lines of what they've said, reflected their anxiety, their worry, and reminded them that they're working really hard to stay well. Make explicit what can be done. So if people are talking about wanting to make some change, I've had patients saying to me, I've been wanting to cut down on the drinking. It's easy to do that now because the supermarket stores are stopping selling alcohol because it's not considered essential. So it's actually a little bit easier for me to do that now. And so I can talk them through that process and help them to develop a plan. Or people who are wanting to stop smoking saying, I know it's not going to be easy, but this is an ideal opportunity. So make use of that opportunity if people themselves are wanting to talk about change. But help them to keep that change manageable, and so they don't set themselves up to fail with doing something that may be very difficult to do under these challenging circumstances and make too many changes all at once, but rein them back and say, how can you do this in a way that works for you, that is manageable? Encouraging them to be proactive. What can they do, even if it's just shouting over the fence next door to check that the neighbour's okay, for example, so that they feel less of a victim in what's happening and more of a participant in their social group. That might be reaching out to family members as well, of course, because family members will be very worried about how a person living with a long-term condition is managing. And then the last point is, if people do want to make changes, then think about the model that I work to, which is we call the COMBI model. And what that stands for is just checking that people have the capability, that's the C bit, the capability to make this change at this moment in time. Is this an ideal opportunity? That's the O bit. Some people would argue it's a good opportunity. Other people will say this is not the right opportunity. You have to go with whatever they think is right. The M bit stands for motivation. How high is their motivation to do this at this moment in time? And the B bit is about behavior change. So we use those three components. When they come together, the capability, the opportunity, and the motivation, then we tend to see the behavior change, as long as the plan is manageable.
Hi, Chris. Sorry, Nicole. Yeah. Just wanted to give you a time check for about 5 more minutes. Thanks.
Okay, fine. We're almost there. Talking about supporting well-being, which is what we've been talking about so far, of course, but there are a couple of other things that I wanted to cover. One is the psychological cost to this challenge, this threat that we're all dealing with, that people's coping resources may be reduced, and we need to recognize that and be very explicit with people and say that, you know, all of us are operating with far less resource than we would be normally, because this is taking a toll on us in terms of sleeping, in terms of concentration, etc. Having a goal and setting plans is really helpful. That's for all of us, not just for patients. You know, I've already talked about my goal and plan for today, and I'll set another one for tomorrow because it's the thing that keeps the structure in our day. Having self-compassion, and that means just being kind to ourselves. Treat ourselves as we would treat a family member or a really loved friend, and apply that to ourselves. So don't give ourselves a hard time if we don't meet today's goal, for example, because something happened. And just say, next time I need to manage that goal differently. I need to make sure that I get up earlier, or that I make sure I don't schedule a meeting in at lunchtime so that I can go for a run, for example, from my perspective. So that self-compassion is important. Whenever possible, use change talk. So talk about when this finishes at the end of this period, so people don't feel completely stuck and trapped, that they can see that there will be, of course, there will be an end to this lockdown. We will all be changed at the end of this, and some of that change will be for the better, but it will come to an end and things will be different. But also reminding people that when they have a call with you, that they need to finish on an action. And I would be saying to people, whether I'm seeing them face-to-face in the clinic, whether I'm doing the virtual clinics at the moment, I will say, so what's your plan? What are you planning to do now, based on what we've talked about? And that, again, seems to give a little bit of momentum to keep people going. Okay, so 5 top tips for offering support. Just summing up, keep listening. Tune into people's patterns. If you're hearing them say the same things and the same reactions, point it out to them to say, you know, when we're anxious, we get into a sort of vicious cycle or a rut. And I'm just wondering if that's what I'm hearing from you at the moment. Teach them to be their own, if you like, their own support mechanism, to look for patterns in the way that they're thinking and behaving as well. Encourage people to keep talking, doing it manageably, scheduling it in, doing it not as frequently as they would like to do, because what they're doing is looking for certainty that won't be there. From your perspective, keep informed and stay up to date. From the person's perspective, the patient, to stay informed, but manage their exposure, particularly to social media, which we know generates further anxiety, but to use reliable sources, such as your organization or trusted sources. Emphasize the importance of structure and keeping occupied. My mother used to say, particularly when we were little, idle hands leads to busy minds. So we get fretting and worrying about things when we're not occupied. And I think at this moment in time, we all have an ideal opportunity, even though that opportunity, of course, might be one that we wouldn't have welcomed, but to do things differently and maybe resurrect old hobbies possibly. Finally, recognize that this is going to have a cost to you as well. Listening to people talk about their worries takes its toll on you as an individual. As a trained psychologist, you know, we have sessions that always end with a 10-minute block after the patient has left, before we start talking to someone else, where you have an opportunity to reset, because it takes its toll on you emotionally. Recognize your patterns. If you're getting into a particular type of conversation with a particular patient, you need to do something to disrupt that a little bit if it's unhelpful. Of course, if it's helpful, keep doing it, but just be aware of, oh no, when the patients say this, I tend to hear myself say that, and that's possibly not helpful. Self-compassion, be kind to yourself. Recognize that this is having a cost to you. There will be patients you're looking after, family members that you're looking after, team members you're looking after. Just before I had this call with you, one of my team members has been told she has to leave her flat because her boyfriend's brother, who's a doctor, has to self-isolate. So she's homeless. So I'm now having to look after a team member as well. And then finally, recognize that this is a marathon and not a sprint. And thank you for all the hard work that you're doing at this difficult time. We're all struggling, but hopefully we're making the best of it. So a really big thank you. And I'll end there.